Today we're honored to welcome Dr. Greg Burzynski to the show today. I'm very excited to have him on. We're going to talk about some amazing topics that are always going to affect people in the field of wellness, right? So, integrative wellness, we have preventive medicine, we have longevity, regenerative medicine, everything that we talk about, it goes together, right? Essentially, looking at not just being able to have a problem and get it fixed, how do we actually be resilient and know how to stay healthy within that process so we don't actually have to get to that place in a sense, right? It's all about being able to take control of our own wellness. That's the way I look at it. And he has amazing insights on this and actually how to implement this in our own lives today. So, how are you doing today, Dr. Craig?
I'm doing great. Thank you for the beautiful intro.
Absolutely. So, I'm very curious to hear your story and how you got into wellness, integrative medicine, and everything you're doing today to be of service.
Well, growing up, my parents being doctors, it was an idea that you should be a doctor too, help people, etc. Now, it was interesting because he had a treatment for cancer, brain tumors. He was doing clinical trials for it. So I was one that was exposed to what else can we do beyond the standard of care, right? Because the standard of care is very interesting, right? You have a disease, you go to the doctor, you hopefully get help. But you learn about this and you go to residency and you see that there are so many more things than just a standard of care. Standard of care can be good. I'm all for it. I'm board certified. But what else can we do to be healthier people? That's the question we're all looking for. And I think the earlier the better. You don't want to be 70 years old and getting this news from the doctor. You want to get ahead of that way earlier.
Yeah, that makes sense. Because standard of care, it's standard, right? It doesn't mean it's going to be personalized to you, right? That's the whole thing. It's like this thing may work for some people, but it's not going to work for everyone. And oftentimes these individuals are wondering why they're not getting results, right? But it comes down to personalized care, it sounds like, too.
Exactly, and you have to get the blessing, right, from the insurance company. Another doctor has to agree. There's so much what ifs. So in a couple years, they mentioned a cancer screen, a blood test could be ready for insurance approved. Right now, it's ready, but you have to pay for it. But that could help you so much if you get that and it actually discovers a cancer that could have knocked you off, right? So it's part of that tied thing with also insurance and people thinking what a doctor patient relationship should be.
Exactly. I mean, oftentimes what I see is like when people go to the doctor, it's usually like almost a one-way relationship where the doctor has all the answers and like it's almost like it, in my mind it should be like a coaching relationship in a sense. Like a doctor should be an advisor in a sense. Doesn't the word doctor even mean teacher in of itself?
Yeah, you got it right. Exactly. I took a little Latin in
Yeah.
elementary school, or I should say eighth grade, and I remember that. Yeah.
Yeah, it's very interesting, right? Because when people act as advisors, I feel like that's the best way because now they don't have all the answers, right? They definitely want to be of service and they want to help, but ultimately, like we have to make our own decisions at the end of the day. Even though if like someone wants to be of service, it doesn't mean like they have the right tools in a sense either, right?
Yeah, exactly. You want to be, it's like having an attorney, right? You have the same attorney usually, right? And now in this doctor patient world, we have like nurse practitioners, we have different doctors, and they're allowed to do things, not allowed to do things. It's changed a lot than about 100 or 80 years ago, I'd say.
Yeah, I believe that was back like the flexion report. Is that right?
I think so, yeah.
Yeah, it's like because to my understanding, like the allopathic medicine, it was kind of like the minority in a sense until like that situation took place, and then people are kind of going down that path where if I have some type of issue, I must need a drug in a sense, right? Of course, everything has its place, like especially emergency medicine and all that is great, but if it's like if we're not focused on lifestyle, we're kind of missing the point. I see too.
Yeah, I think we're hopefully gonna come back, and I think people will be better. That's the bottom line.
Yeah, that's what I see as well. It's like it seems to be a lot more popular as in a sense, like more people are being informed, right? It's like
Yes,
through different shows, different self education platforms. It's like now people are being empowered. That's how it should be. Like
yes,
we
and
should be
there's
able to
also
know how to
the
be
world.
healthy,
Yeah, and
right?
there's the world of AI. So they ask, "What do you think about this antibiotic my doctor gave me?" What do you think I should do? Right? So they have kind of their personal advisor with them. A lot of people do. It's interesting.
Very interesting to think about, right? It's like we all have like our own experience with things, and like as you know, like health is such a personalized process, right? Like, of course, there are foundational things that make things work. Whatever it is we're talking about, it's sleep, nutrition, exercise, stress management. Like, they're foundational pillars, right? But then how do we personalize that based on our own goals and our own needs, in a sense, too?
Exactly. Yeah.
Yeah. So, how would you define restorative medicine? Like, what does that mean, and how can we actually take control of that in our own lives?
Well, I believe it's something that we want to start earlier than later, right? And we want to see what your body looks like, right? Because at the age of 30, you could have something that's beginning, right? So, like also mental counseling, by the way, I recommend now people think about just getting a little bit of that just to get checked in, so to speak. They don't have to continue, but it's also with your health. See what your body looks like. What's your genetics look like? What are these blood uh, news that you're getting? What could be problematic to you? All right, so that's the way I look at medicine. We want to make sure you're okay at that age and beyond.
Got it. Makes sense. So, it sounds like having some awareness and like all these tools that we can utilize, right? It's like a self assessment process, right? So
Yeah.
then, what can I do? Like, what are the tools that are available, right? Because a lot of times we have a narrow focus on what we can do, but there's so much things we can if we just start to kind of open our minds to it, in a sense.
Exactly. For a certain age, we are given everything at a free price per se, right? We can just work out, we can exercise, we can eat, sleep, and those are very important tools. But at some level, our body breaks down, and when our body breaks down, before that, we want to make the best choices for it, so we don't have problems down the line.
Exactly. Why do you think that a lot of people were kind of so reactive in terms of our health? Like, we don't do anything until we have a problem. Like, why is that in society?
Yeah, it's sad. I think the industries just gave that message to the people, right? So, for example, the food companies decided to give certain foods to people because they wanted to make more money. Then there was the insurance industry and health industry, right? So the idea was go to the doctor when you're sick and take this and so forth. So it kind of just told everybody this is what we need to be doing, right? But there's so many things we could do way better, right? For example, you can look for that cancer way earlier. You can look for heart disease way earlier. You can look for metabolic problems way earlier. You don't have to look at them when you just have the problem. So I think if you have a, let's say you have prediabetes or early sugar issues, you should probably get aware of that. You should probably realize this is going to be a problem later, right? And there's so many things you can do now.
Yeah, it makes sense. It's like, because we know it's not the genes cause disease per se, it's more so about the epigenetics and control above the genes, right? So like our lifestyle can activate these genes or not, right? And you just kind of mentioned it's like when we have a predisposition to say diabetes, right? Doesn't mean you're going to get it. But now, if we know that, maybe take necessary actions to kind of prevent that in a sense, like maybe a certain nutrition choices, for example, right?
Yes, exactly. I mean, speaking of epigenetics, we have the two brothers that keep have the same genome, but epigenetically, one lives in one place, one lives in a different place. So they're going to have different epigenetics. So the one that's much healthier should realize his unhealthy brother needs to adapt some of these things, and hopefully
Yeah.
they can figure it out.
We see that in twins too, right? It's like basically very similar genetics, but yet they can be have totally different places for wellness. So it's kind of like
Exactly.
proof of that in a sense.
Yeah, and we saw that actually in the space thing where we had somebody go to space that was identical. He had his twin brother, and you saw the changes. He aged dramatically in space, had big epigenetic issues, and hopefully he got that fixed.
Wow, yeah. I mean, because a lot of us were carrying around this victim mentality where if health just happens, these things just happen. There's nothing I can do. And with that type of mentality, what type of action are you going to take? Probably not a lot, right?
Exactly. You have to realize that you need to do what's best for you. You need to uh, learn about all these things, survive really.
Yeah. I mean, the way I look at it is you have to believe in possibility. You have to believe in your healing, right?
Mm.
Because ultimately the power is in your hands with every single decision that we make, with nutrition, your sleep, your exercise. A lot of times, like, we look at health as one thing. So maybe we're taking control of our nutrition and exercise, and that's great. I mean, just be honest. A lot of times when people think are eating well, they're usually not. But just said they are. There's so much opportunity on the table. Okay, so you know, am I not sleeping? Is there a certain stress management practice I'm not taking advantage of? Like all these things, there's so much opportunity, and then we can go into the regenerative medicine. Like, so just what I'm trying to say is like we have to open our mind to possibility in a sense because there's so much.
Exactly. Think what's best for you and learn what's best for you.
Yeah, that's a good point. Like, how do we actually find out what that is, right? Because we talk about the process of self-assessment and where are we, what are our goals, and then we kind of put together a plan in a sense. Like, how do we start to do that if we're kind of just getting started in a sense?
Well, it depends, right? How you're aging, of course, but
Yeah.
so what you're doing with your life. Like you have kids, right? You'll probably change things about yourself, right? You're gonna say, "I want my kids to be as healthy and wonderful as possible, and I want to be wonderful for them." So then you go down that path of making sure you're doing the right things. You're giving your kids the right food, they're doing the right exercises, they're sleeping, and as you age, you learn about yourself, right? What can I do to not have problems down the line? That is a big journey, I think.
I love that, man. It's like you have to be a model and example for what's possible, right? Because as you
Yes.
just mentioned, like people around us, they're watching in a sense. Even though if like it may not even be a conscious thing, we just kind of like pick up people's habits, we pick up people's ways of being, and if we realize that hey, health is something that we can utilize for everything in a sense, like we can have the energy to make our dreams a reality, we can have better relationships, wealth, all these things, and also we have to essentially be willing to sacrifice who we are for what we could become in a sense, because I feel like a lot of us are kind of tied to old ways of being, but we don't necessarily understand this is actually a better way. But it's a process, and you're becoming someone within that process.
Yes, and these people need to understand that because you meet some people and they don't want to do it, right? They don't want to change what they've been doing that's harmful. And it's kind of sad. They're not ready yet for whatever reason. And
Yeah,
you want to be associated with the best people around you. That's something I've learned, right? You want to be associated with those people that are going to help you the most.
100%. What are some common barriers that you see for people taking action in terms of wellness? Like, is there certain reasons that you see come up and again and again?
I think sometimes the cost, right? Because
Yeah,
they want something for free, but they're going to have to pay a little bit. They won't have to pay very much, but they're kind of like, why isn't the insurance world paying for all this, right? Then it can be um, the question, do they need a peptide, right? Maybe, maybe not, right? So there's a bit of reluctance and a bit of work they have to still read about certain things and understand that this is the best way, perhaps, yeah.
yeah. It's like understanding that also like you kind of are the number one investment. You have to invest in your health,
Yeah.
right? Because ultimately, I assume we have like health span and lifespan, right? Health span
Hmm.
being how much health we have within our years, and lifespan like the actual number, right? But it's like, what are you willing to invest in order to be the best version of you? Like we have to kind of like have that mindset shift in a sense because I mean it's your life, right? You have to be like you have to own it in a sense.
Oh, exactly. And if you look at history, right, people
Yeah,
did not live very long, right? Like over 100 years ago, they maybe lived to 40, right? And
right.
now we have better livelihood, so to speak, and we have great things coming around the corner that are going to change everything. So it's kind of like, you know, you you get your house ready for certain things. You should get also your body ready for certain things just to be in that position, be the best person, you know?
100%. Yeah, because longevity is something you talk about as well. It's like we don't just want to like be here in a sense, but we actually want to like actually live the experience we want to, right? Because a lot of times we have this vision of our mind of aging, and it's really bad. It doesn't have to be like that in a sense. Like to my
Exactly.
understanding, like it can be a lot more graceful. Is that right?
Yeah, exactly. I mean, who would not want to be 80 years old but feeling good or
Yeah,
feeling like they were when they were 50, right? We've seen kind of different things. We've seen those 80-year-olds, but typically not very healthy. But now there are a lot of people that are very healthy. They're giving us hope, I think, also. And there's so many things in the pipeline that can change that.
yeah, exactly. Like when it comes to longevity, like what are kind of the basics of that, like to sustaining wellness? I would imagine it comes down to our day-to-day choices that we're kind of overlooking.
Well, I think so. You have to kind of gravitate to those that are more interested in certain things and also do the right things. So if you're stuck in your world that's limited, then that's a shame, right? You have to go seek the people that are going to help you live longer, expand, and do all the things that really will help you.
Yeah. So when it comes to the fundamentals, like what are some things that we can look at if we're just getting started? Like because a lot of us we're just kind of going along the standard path. We don't necessarily have the awareness of what to do. Like where would you have people look in order to kind of start that process?
Sure. Well, learn about your parents, right? What did they give you as a body? So learn about that genetics possibly if you can, but also what diseases they had and caused problems in their life. That can also allow you to focus more on certain things. It will be also very helpful at some age, like let's say 35, get a good blood work, also imaging study, and other things to see where you are, right? Because it's going to be way better to fix things at that age than perhaps at 75. I can do it at 75, I can try my best, but okay, there might be some limitations.
Right. Yeah. So back to proactive care again.
Yeah, it's all about the proactive care. But the good news is, if you get on board, you're not going to have to do that much, right? It's kind of like brushing your teeth every day. You just brush your teeth. You don't have to really do so much to prevent that cavity, that disease, right?
Right.
It's more spread out over time.
Yeah. I mean, we have this mindset of like one day I'll start, but it's like something we don't necessarily understand is that once we start now, we actually start to feel better. Like our old habits and ways of being, they're not actually kind of in alignment with, I guess, our best selves in a sense. Because once you start to do that, go along that path, you start to feel more vibrant now, right? All
There you
these
go.
things that you you want are possible. You just got to get started at some point.
Yeah, and if you're more vibrant, well, guess what? You're a better person for your family, your wife maybe, and then your business, right? If you have a business, you're going to get better ideas and you're going to do better. So that means
Yeah,
more money, hopefully. And then what else? The world's your oyster.
for sure. I feel like a lot of it's like perhaps it's the initial resistance of people getting started. It's like because maybe it's an overwhelming thing. It's like I think it's so complex and all that, but I feel like if we start to make things simple, that's going to be the most effective thing too. Because like simplicity is usually the ultimate form of sophistication. Like, it's actually going to work instead of like
Yeah,
overcomplicating things. You know?
exactly.
Yeah.
Yeah, I think there are people that are getting on the course of being better and they go to the gym, they eat well, they sleep well, they care about this, they understand what how important this is. But there are other people that still are just not on board. And for whatever reason, they should be.
Yeah. Makes sense. It's like kind of like you mentioned before. You need to have like people around you that are willing to support your goals as well, right? Like
Exactly.
like or if you're looking to work with a guide or a doctor, it's like make sure they are in alignment with what you actually want. If somebody's telling you that you can't get well, it just necessarily doesn't mean that you can't. It just means that they don't know how to help you, right? So you have to find
Yeah,
someone who's actually willing to be in line with your own process too.
exactly.
Yeah. it's so important because like a lot of times we just get like so discouraged because like we don't necessarily surround ourselves with possibility and positivity. So it kind of makes it a lot more difficult, and there's a lot more resistance too. So do what you can to stack the conditions in your favor because it's hard enough to be well in the modern world. So you have to actually do everything that you can, and you have to trust the process too.
Yeah, and the amount of dedication can be variable, of course, to that because and the people I've met some people very motivated. Like their son has a problem with his health, he will actually do something and learn about it, and he will even launch a company to start a clinical trial, right? So the motivation is so big, right, in some instances. And you don't have to do that, of course, but just getting more involved, I think, in this process will definitely serve you better.
Yeah. So you had mentioned testing in labs. Like it's probably going to be personalized, but is there anything that comes to mind that would be really important for people to at least consider?
Well, the basics, right? We don't want to die, right? So we have to get that answer. We have to get it answered, right? So what's concerning like that? Do we have any, depending on what your age is, your cancer history, your heart disease problems? I think those are number one and number two because those are the chief uh, uh, unfortunate problems of the world. So then we go a bit further. Once we're okay, we can go into, well, how, and again, it's an age question, right? If you're like in your late 40s, you probably want to be more attractive, you're going to have better muscle, you want better energy. These are the typical, what I hear, goals, right? So then there's the whole world of medicines, supplements, and peptides, right? And you can consider all those depending on what is going on in your body, right? And hopefully everything is good. But during that workup, we say we would make sure everything is appropriate and try to fix it if we need to.
Yeah. Because as you mentioned, like there's so many different things we can do. Like, you know, the field of regenerative medicine is growing, and there's like peptides, there's all these things we can consider, right? But it's like going back to personalization. After you have the basics down, right? So you have to like at least make sure you got your lifestyle right. Because if
Mm-hmm.
you want sustained
Yeah.
wellness, you don't necessarily want a quick fix either.
Of course, if you're not sleeping, overweight, drinking too much, you need to fix that, right?
Yeah.
That's the basic. Yeah. That's something I don't need to necessarily help you with, but you need to know about that. Maybe
Yeah.
somebody could, of course, but it's very important.
Yeah. So let's say we're at that point. Like, how would we kind of know what we need in terms of these tools that we have in terms of regenerative medicine and like as you mentioned, like stem cells, peptides. Like, how do we actually know? Is there some self-assessment process or evaluation that we can go to?
Yeah, certainly. So again, depends on what your age is, what your risks are. Also, what is the problem, right? So if your joints hurt, if you have some knee problems, shoulder problems, then maybe you could do something to repair that. If you have a atherosclerosis risk, a coronary disease risk, well, guess what? We need to go at that, right? We need to fix it and make it better. If you have other epigenetics, so issues that are occurring, we can also fix that. There's a bunch of things we can do, but I prefer going at the ones that are most serious and most uncomfortable to the person, right? Because you could be pretty healthy and you could have just the epigenetic problem, so to speak, or something like inflammation, but I think you have to go at the deadly issues first, the ones that are most concerning.
Right. So it's like, what is like the most important thing we're dealing with, and kind of go from there in a sense.
Exactly, because you could be given the information that on a coronary calcium scan you had atherosclerosis in the arteries, right? You're 50 years old, and you need not know that. That's a problem, right? Because that could cause you to have an event, right? Some event that maybe your dad did, your friend did, and that could change life for you so much. And it's a systemic disease, right? So if we have it in the coronary arteries, we probably have it elsewhere, right? So
Yeah.
the name of the game is trying to reverse that and also look at what else could be a problem down the line.
Exactly. I mean, I feel like it's not about being perfect either. It's about progress because we have to not just be willing to kind of overwhelm ourselves. Like there's so much to do. Just make it simple, right? It's like
Yeah,
what is necessary right now, and just take the action and get those small wins in. Like just focus on the process, and
exactly.
eventually you're going to reach your goals at some point.
I've yet to meet a perfect patient or person, so I don't think I will, but maybe with the robots that will happen.
Right. Yeah. It's like I don't know. It's a journey, and it always is going to be a journey. I see because all we have is right now. It's like even if like you have everything uh, down in terms of fundamentals, it's like I feel like there's always more to learn, and that in of itself is a fun process too.
Exactly, and the body could be wonderful, but the brain could have some issues, and we
Right.
can tackle that as well.
Yeah, that's a good point because, as you know, like, everything is connected and like everything works together. And
Hmm.
if we're neglecting something, maybe we have like a lot of practices down in terms of wellness, but maybe we're just not sleeping. It's like it's going to affect everything else because it's kind of the glue that holds your health together, right? Sleep. So it's like just being aware of these things and you know making adjustments over time to kind of keep that peak state of wellness too.
Exactly, the little fixes can go a long way.
Exactly. And in terms of genomics, like are these tests something that you do? Is there something that we should look out for in terms of that? Like, what is the reliability when it comes to these things as well?
Genomics are very interesting, right? So this is a blueprint, and typically your parents gave you the combination of that. So you're given a unique gene signature. Now, working it up is important because you may have some just cancer genes that might hurt you. Like 10% of people have a cancer gene that might cause a problem. You can also have Alzheimer genes, also other genes which cause problems, right? So we're also made of these genes. Like you, in the way that I'll explain, I had a gene test, and my wife had a gene test, and the best company to do that, we use New Amsterdam Genomics. It's basically you type in what you're looking for and you find it, and it's constantly updated all the time, because this is a thing that we're working on to learn about every gene. Right? People are doing research papers and you're getting that information. So we don't have all the genes figured out yet. But it was interesting because I learned I have a tooth problem and my wife has a tooth problem, but we don't have teeth. It was a very recessive gene. But then guess what? Our kids had it. Okay, they had the tooth problem, so they had one less tooth that was formed. Very interesting, right? So I think genetics is really interesting because certain genes can help you. They can be the good genes, and they can be the bad genes, right? So you can see what could be coming down the pathway and how can we go make you healthier even. It's
Yeah, it
interesting.
makes
It's
sense.
basically what you're made of. You see that gene analysis and you kind of say, oh yeah, that is me. Interesting.
Yeah. What are some common misconceptions that you see people carry around when it comes to genetics?
Huh. Well, I think they just think too seriously on the genes that were discovered in that gene test, for example. So you have a lot of genes, right? You have like 20,000 genes. Some are not that significant, others are. So just because you've been labeled to have one gene, does that mean everything will be terrible? Because you have another gene possibly protecting you. So some genes also give you more credibility, and also some are more serious. So I would have to say, when you get a gene study like that, and just realize that most of the stuff is pretty just benign. Okay, it's not going to hurt you, but certain things if it is serious, we should go and learn about. We should learn how to maybe make you healthier, and if there are medicines, strategies to do it, we can go into that.
So it sounds like not being in a state of fear about this.
Yes, exactly. Because there are so many genes. As mentioned, there's 20,000 genes, right? So if you get some that are concerning or give you a bad rap, don't get too devastated by that. You can learn more how you can improve some things, and also you have others that are helping you probably.
Right. There's so much to learn about genetics as well. It's like we don't necessarily have all the information, so it's not like, oh, this is like this. We don't want to give ourselves a nocebo effect, right? It's like
Yeah,
basically giving
exactly.
ourselves like this negative injunction, and now we're fine before. Now all of a sudden we're just not because of information, right? It's like we got to be careful of our mind in terms of things like that too.
Yeah, and in the end, it's just a risk of something happening and it's not guaranteed.
Yeah, like it's very cool to have information, right? So we can actually uh, apply it in our own lives. But also, we don't want to like be neurotic about certain things, right? Just kind of got to trust the process and just kind of like be relaxed in a sense, because health is supposed to feel good. Like health is supposed to be vibrant and all these things, and a lot of times like it's like our mind is the foundation of how we make our decisions. So it's like we just got to be careful of how we proceed sometimes.
Exactly. Yeah.
Yeah. So when it comes to epigenetics, like what is that exactly? And are there certain lifestyle factors that would come into play that comes to mind? Like, what influence do we have over our genes to our day-to-day decisions that we make?
Well, epigenetics is a fascinating field, right? And it's growing with the testing. It's still not quite there, but it's getting better. And two epigenetic tests I think that are okay are one dealing with a heart disease and also with just how every system is aging, right? True diagnostics, for example. So, for example, if you do a heart scan, you do lipids, you do blood work, and you do the epigenetic test, you put it all together and you're like, interesting. I have a message here from the epigenetic test that says that I'm going to have a heart problem probably down the line. And guess what? This lipid panel, I have a problem, and in the coronary scan, I could have a problem, right? So it's something that you can repeat, by the way. And I did this because I found out I have a risk for coronary artery disease that was a little slight on the epigenetic test, and I I did Repatha, by the way, which is a great medicine. It's a monoclonal antibody you inject twice. But I also have a history of heart disease in my family. So I don't want that, right? So simply put, my epigenetic score got magnificent after my lipids got better and everything else, right? So I think it can help you it can help you guide you how you should go, right? With that being said, the epigenetic test, the true diagnostic, can also tell you how you're aging. Are you really behaving, so to speak? Are you getting enough sleep? Are you drinking too much? How can we improve on this? So this will be a snapshot of how things are going on in the body, all right? So I think that's a very interesting test, and hopefully we'll get even better.
Yeah. So it makes like the self-evaluation process and goes back to the powers in our hands, right? That we can
Yep.
make our health better through our decisions, and that's something I always find very fascinating, right? Because the pen is in our hands, and we get to write our story every single day,
Yeah.
and so exciting to actually do that. So, also in the field of genetics, we know that the mind also plays a huge role, right? Because like how we think, how we feel, all these things, like 'cause
Yes.
they all work together, right? It's like always like to talk about psychoneuroimmunology and psychoneuroendocrinology, right? Basically, how
Right.
our thoughts, our feelings literally impact our biology. Do you see that
Oh
as
yeah.
well when it comes to epigenetics?
Definitely. Yes.
Yeah, very fascinating. It's like the influence that we have is mind blowing sometimes because we just like we don't we don't understand the power that we have, and that's why oftentimes it's not the solution doesn't exist. It's that we're not receptive to the solution based on our current paradigm, right? So we have to usually shift our mindset and then take the preceding actions.
Definitely, and just realizing that you were raised by a group of people, your parents, and everybody has different ones, and they told you different things. They raised you, and then you became adult, and you became maybe a 50% representation of them, right? Which is very interesting, right? I say sometimes, but all that messaging that they gave you, did something, I think. And if we want to reverse it or make you better, then you also need that messaging, right? You also need that level of counseling, probably. It'd be so much easier if you could just take this medicine, call it a beautiful day, and poof, everything would be better. But we haven't gotten there yet. It's still a world of you need to do some counseling, some exercise, maybe some medicine occasionally, but these are the things I think that get people to where they want to be.
For sure. Now, in terms of integrative care, like how does the conventional medicine fit into, I guess what we're talking about here? Like, is there a certain place for that? Like, how do we know what to use in a certain situation? Like, is it for emergencies? Like, what's your take on that?
Well, I think the person that is coming to you should be aware that you're going to do a bigger workup and ask more questions, because you can go to an insurance clinic or somebody that does the basic standard of care, and you can get all that, but it'll be much smaller and it won't cost you very much. And they'll say, "Have a nice day. Oh, you have this X, Y, and Z," or nothing, right? So with me, you get a way more comprehensive workup, right? You don't just get the lipid panel, you get the inflammatory molecules, you get the ApoB, you get so much more, right? All this, that's just an example, right? Can help move you in a healthier direction. You can get a DEXA scan, right? That'll take 6 minutes. You can see how much visceral fat you have. What are your muscles? You can do a gene test. You can see what maybe we have that could be concerning. You could even look at more blood work, like do you have any concern of Alzheimer's disease, right? We do much more testing that's much more accurate, and if the person is okay with that, then they can come with us, but they have to be okay, they have to be ready to essentially do that, I think, as opposed to do less.
Yeah, and willingness is key, right? You have to,
Yeah,
of course, have the information, but you also have to have the strong desire to actually be well.
yeah, and hopefully people understand. Yeah,
Yeah, because there's so much we can do, but like, what are we then willing to do to start that process, right? It's like, again, we have to keep our why in mind and know who we're doing this for and have the strong reasons. Because it can be difficult sometimes. Like, there are going to be setbacks and be challenges, but like, as long as you have that North Star in mind, it's like, just like, understand it's part of the process. You got to embrace it.
yeah. I mean, you simply say, "Do I want to be healthy and as long as possible?" If yes, okay. Well, my insurance physical is going to be very basic, and that might not make it happen that way, you know?
Right. Yeah, we have to go beyond the conventional paradigm in instances.
Yeah.
And again, realizing that there's so much tools available, so we just got to open our minds to it. It's like yeah, the medical system, they're great for certain things, but it's like, you know, what is going to be reliable in terms of sustained wellness, right? It's like, that's what it's all about, and then knowing what you need as your health proceeds and what comes up, right? Not so it can be kind of a skill too. So that's why it's good to work with advisors sometimes.
Yeah, exactly.
Yeah. So, integrative care is like, how would you describe that exactly? Is it utilizing like everything together, or is it kind of combination? Like, what are your thoughts on that?
Yeah, exactly. I think very simply, it's standard of care, basic, and then some, right? Because you can go in and get a blood test at another doctor's clinic, but are they going to do a micronutrient analysis, right? Are they going to do a gut test? Are they going to look at X, Y, and Z else, right? Because it will really help you get better. And that'll probably save time in the end, because you don't need to be referred to all these people for that extra help.
Yeah, we kind of overcomplicate the process. We got to go to so many different doctors and specialists, but it's like they're all connected to the same thing ultimately, right?
Yeah, and they might serve a purpose, but not for everybody, I don't think. Yeah.
Yeah, for sure. I mean, oftentimes when we go to all these people, they're not communicating with each other either. So you can have all this, polypharmacy, right? So you're like so many drug
Yeah.
interactions that we don't know, and it's very interesting because like I don't feel like it should be like that. We should have like a cohesive team. But it doesn't seem to appear like that.
Unfortunately, yeah, that's how it is. Usually.
Why is it like that? I mean, we should probably be better at this point.
I think one of the things we'll work on, I think, we need to communicate better. You're right.
Yeah, being able to ask questions, like the power of question is so key. Like just being curious,
Yeah,
and it's like quality of our question is really is going to determine the quality of our lives, right? It's like being able to not ask these disempowering questions on a regular basis, like why me, why is this happening, and things like that. It's like because your brain is going to look for what you're asking in a sense.
hmm yeah,
So we have to be more conscious in not just that, but also how we speak, right? Because our minds are listening. So how can we take advantage of that and actually move forward in a healthy manner as opposed to the opposite?
exactly. And I'm happy to talk to any doctor, but some doctors are not so excited. So I think that needs to kind of change. And I think, like in our clinic, for example, we message each other. Everybody knows stuff very quickly. I wish we had that with the doctor community, some way, somehow.
Yeah, in terms of open mindedness too, because a lot of times we're just kind of stuck in our ways. We don't want to learn new things that could potentially help people, right? It's like we've been taught one way of being, but we don't necessarily open our minds to the possibility of something different. That not only that it's like it's not necessarily new because we've been doing these things for thousands of years, like in order to be healthy. It's
Yeah.
like it's not necessarily new. We just kind of have to like be receptive to it.
Exactly. I'm willing to talk to anybody, but some doctors are not so willing and not so excited, let's just say. But it's a shame, right? Because we're on the same team, but
Right.
we're not really communicating like we should. And they have some opinions that probably need to change.
Yeah. Because as you know, it's like they care. It's just like they kind of like are taught in a certain way that they almost doesn't allow for them to help the people that they need help. Right. It's like
Yeah.
they spend very little time with them, and it's very difficult to actually do some self-assessment within that. So what I'm doing working, right? It's like because they're in a rush all the time, right? So it's hard to
Yeah.
actually think and create space too.
Exactly. I had a person I actually spoke with this week. He had some difficult news, meaning I ordered a heart scan on him, and he found out that he did have some heart disease, right? And he's in the prime of his life in a way. He sold his company a few years ago. His son got married. He had a beautiful trip, X, Y, and Z. And now he met with a cardiologist, and one that he was referred to that was excellent, right? And cardiologist probably should talk to me, but it's a process, right? Because I'm willing to talk to him about what he's going to do because already the patient is not happy with what the cardiologist recommended. So we all need to be a team in that short term just to get everybody better on the same page.
Yeah. Do you find like the open-mindedness of, let's say, a regular doctor to talk to uh, more of a holistic wellness practitioner? Are they open-minded to that, or are they usually they don't want to do anything with that at all?
Yeah, I think it really just depends on personality so much. Like, do they have a bad day? Do they have a lot of patience? Are
Right.
they very busy? What do they think about this other person they're going to talk to, meaning me? What information have they gotten over me? Like, have they learned that I'm just an internist? Oh, and functional medicine, X, Y, and Z. It all depends what is coming at them, I think.
Yeah, it can be situational, maybe like like the state of mind that they're in, like so many different things, like our beliefs, our paradigms, like.
Yeah.
But ultimately, results speak for themselves, right? Because like
hmm
a lot of times, like the patient will get results in a holistic manner, right? But then it's kind of like write it off, right? It's like what's up with that?
Yeah, and I offer both, right? I give people options, so they're free to choose. They can do everything.
Yeah, I mean, obviously, I kind of get fascinated with placebo, right? It's like because you get this treatment that shouldn't do anything, but it does based off our mind, right?
Yeah,
and it works for everything, like surgeries. Like it's very interesting to think about, right? Because the power of our minds, going back to that, it's like we have so much potential within us, but a lot of times, like the conventional doctors, they don't want to necessarily look at, hey, this actually worked, right?
right.
What can I learn? It's like, oh, just I, I don't know how this happened, but they're just kind of on the next thing, unfortunately.
Exactly. And the reverse can be true, right? You give
Yeah,
somebody some bad news that you shouldn't have given, or some bad stuff, and they don't get better, right?
yeah, very interesting, right? It's like so much goes into that, but so is there anything else that comes to mind for you in terms of integrative care or holistic medicine that we haven't covered yet?
I mean, basically, if you're at that point in your life that you're thinking, what's next? Meaning, you're in your 40s, you're in your 50s, you maybe could be late 30s. I think you need to reassess your things, right? Get that checkup that really matters and go from there because it's important. I mean, your life is the most important thing. You need to do things that are going to help you. And it doesn't have to be me, but somebody like me or somebody who's thinking about certain things should get involved.
Yeah. So power of self-assessment and putting together a plan is key.
Yeah, exactly. Because the worst thing is you get some bad news and everything was fine, but it wasn't.
Yeah. Because a lot of times, like we think like everything is good, but sometimes we just gotta make sure of certain things, and other times it's like we don't want to necessarily overlook information. But we don't want to be in a fear state either, because a lot of times like we don't necessarily have all the information in terms of that either. Like we actually have to have a sound mind.
Yeah, exactly. Someone is key.
100%. All right, Dr. Greg, it's been awesome. I really appreciate you today for coming on the show, sharing your story with us, and all your knowledge on wellness in terms of preventive medicine, uh, regenerative medicine, everything that comes together, right? The care that can be incorporated throughout all the different modalities, right? And we all have a process as health, as you know, it's very personalized. And after the basics are done, like what do you actually need? Some testing, perhaps work with someone, and ultimately live your best life, like reach your full potential. And health is the key, right? It's like what it's all about. So, thank you, man.
Thank you so much, Anthony. Had a great time. Be healthy, enjoy your life, and help
For
others.
sure. So,
Take care.
if we can get connected with you and your work, where can we go?
Yeah, definitely check out Houston Concierge Medicine or Restore Longevity. We're an interesting clinic that may be suitable for you.
Awesome. Thank you so much.
Take care. All the best.